Hey everyone, in this video we're going to do a brief introduction to Tourette syndrome, including its epidemiology, its presentation, its diagnosis, and its management. So let's get started. So the key thing to remember about Tourette syndrome is that it's characterized by both motor and vocal tics. You need to have both motor and you need to have vocal tics. Motor tics include things like eye blinking, swallowing, grimacing, and vocal tics include things like grunting, barking, or clearing your throat. Symptoms generally begin before 18 years old, and they can cause impairment socially, at someone's job, or in other significant settings. In regards to epidemiology, males are generally more affected than females. There is a genetic predisposition that's known, and then it's also associated with other conditions like ADHD, learning disabilities, and OCD. And so this is a really important point to note. We mentioned that for Tourette syndrome, you need to have both motor and vocal tics, but it's important to note that you need 2 or more motor tics and 1 or more vocal tics. If you only have 1 motor tic and 1 vocal tic, that is not Tourette syndrome. These tics need to be present for greater than a year, and then the tics need to be recurrent. And you can see on the illustration on the right here, a couple more tics for both motor and vocal tics. So for management and treatment, the best initial treatment that you should pursue in regards to Tourette syndrome is habit reversal therapy. In this form of therapy, it kind of helps you recognize the signs of when a tic is about to happen. You become more mindful of situations that bring out your tics. And so you're kind of equipped with tools that help you manage the tics, and it's very helpful for patients who find themselves struggling with this condition. That being said, it doesn't work for everybody. And if the habit reversal therapy is unsuccessful or it's not as successful as a patient would like it to be, that's when we can try some pharmacological management. And there's a couple different options here. We could start off by talking about anti-dopaminergic agents. There's 2 main mechanisms of action in regards to these drugs that work for Tourette. There's dopamine depleting agents, so this includes tetrabenazine. And then we have dopamine receptor blockers, which are the antipsychotics. So drugs like fluphenazine and risperidone are known to work. And another class, we have our alpha-2 agonists. These are drugs that are used for a couple different things in the psychiatric community. So these include clonidine and guanfacine. Now, these drugs are generally less effective than the ones mentioned above, but they also do have less side effects. So if a patient were to try the anti-dopaminergic agents and find that the side effects from those, especially things like EPS symptoms, are too much to deal with, then we could try these drugs, the clonidine or guanfacine, and they should generally be more tolerable. And lastly, I'd like to finish off with an important differential when a patient presents with a motor or vocal tics. So if a patient presents with a motor tic or a vocal tic, but not both, and they've had it for more than 1 year, so that's either a motor tic for more than 1 year or a vocal tic for more than 1 year, this is actually considered chronic tic disorder. Now you could compare this with Tourette syndrome, which we mentioned. You need to have 2 plus motor tics, 1 plus vocal, and needs to be greater than a year, compared to chronic tic disorder, where you only have a motor tic for greater than a year or a vocal tic for greater than a year. This is a common question that examiners really like to trip students on, so something to be aware of. I hope this video was helpful in summarizing some of the important aspects of Tourette syndrome. If you have any questions, please feel free to leave them below.